Hi, this is Brandon with ChiroUp. I want to give you 5 tools that I use in my practice to help people with lateral epicondylopathy. Not lateral epicondylitis. There's a big difference between those. You know, an itis is more of an acute inflammatory process. There's a link at the bottom of this blog that'll take you to a blog describing what's the difference between itis and apathies. But those apathies are chronic conditions, and when we have chronic reoccurring symptoms, we tend to think it's more of a failed healing response. There are 5 things that I do in my office that significantly help symptoms, depending on the patient presentation and what's going to get the best patient compliance. The first thing is taping. We can use taping like kinesio taping, like Factor, using their dynamic tape to help alleviate symptoms and offload that tissue. We can also absolutely 100% use eccentric exercises. Help get that collagen to rebuild. It really goes a long way as far as building the capacity within those tissues. We can also use extracorporeal shockwave therapy, help break up tissue, help promote a healing response. There's a lot of great research on that, which you see at the bottom of this blog. We can also use shoulder rehab. And that sounds kind of odd, but those patients that have pain in a distal location are going to start to use their muscles in a different way, get a lot more hypertonicity in the upper traps and the shoulder girdle. That's something we need to be addressing. One, for pain relief, but also we need to be addressing that as far as their rehab, making sure they have good scapular stability while they're performing their rehab so they don't develop any kind of compensations. And the last thing is a wrist orthoses, some kind of wrist splint. Here's a picture of one type of splint. I use more of a cock-up splint that you would see for a carpal tunnel syndrome. It's all based on patient compliance and patient comfort, but there's a lot of good research that's going to offload the tissue of the wrist extensors and get them in a position where they can heal. It's about patient compliance so we can get the best possible patient outcomes. Fortunately, ChiroUp has already put all these recommendations and all these exercises in your condition protocols for you and your patients to start applying today. I hope you'll at least take a look at the research and consider looking at the ingredients of your recipes and seeing what makes sense for you and your staff and your patients to get the best possible patient outcomes.